Stuttering can be cured or treated like a defect of the speech fluency. When using a well-targeted methodology, the afflicted person or a child with the assistance of its parents can let the stuttering fade away. It is similar to experiencing a big disappointment, which is followed by arriving at a charming place and spending a beautiful time there. After returning, there has been no trace of the trauma left any longer. Out of sight, out of mind. When you abandon the symptomatic methods, the stuttering fades away by itself. Child will be instructed what is voice and what is mouth. Voice is formed inside. When breathing out, the flow of air oscillates the vocal folds, so the breathing out is accompanied by voice. Mouth, or articulative muscles, then forms the voice, accompanying the breathing out, into a distinctive shape. These two acts mustn't be activated together. They should be like two branches. Parents do not need to give their children lots of instructions. When the voice and the mouth are started from the open vocal folds at the same time, then it will result in a non-defective speech. When the mouth will be started earlier than the voice from the open vocal folds, then it will result in a defective speech. As the real focus of stuttering lies in the subconscious, it's not accessible to us. Our behavior, on the other hand, has its focal point in consciousness and thus can be influenced. Do not ask your children to produce a non-defective speech right away. Let them rather play a game of defective speech. With definition of stuttering as a defect of the speech fluency, the afflicted person is not required to use his or her imagination. In fact, there is no need to explain him or her the visible and audible external signs. Just the speech coming from mouth to the object is taken into account there. If stuttering is defined as a technical genetic deviation, then the things are different. The whole process goes within the brain and the bodily organs. The afflicted people need to get an explanation corresponding to their intellectual capacities. Although they won't need to realize it while speaking, they must be roughly instructed about it to make the process of transformation of the defective plasticity into a non-defective possible. People of all age groups who are afflicted by stuttering should be instructed about potentials of the speech elements and of the speech as a whole. The first animation doesn't belong to the Neurologos Therapy. It serves just for your information. In picture 2 you can see the formative, articulative, branch. In picture 3 there is the ligament or phonetic branch. In picture 4 both branches are started parallelly. In picture 5 both branches are started parallelly, but the speech is in disparallel. Thus the voice gets delayed. In the 6th picture the two branches are started disparallelly. The exercise area should help you to understand the defect. Someone will do with just a little information. Some people, however, may need more assistance, explanation, therapeutic guidance, or mutual contact with other parents of afflicted children. In fact, the cause of stuttering is incredibly simple. The cause is the same in all people. The battlefield area, on the contrary, is more of an individual matter. There has been written, filmed and documented a huge amount of materials dealing with stuttering as a visible and audible phenomenon. Neurologos therapy doesn't take these symptoms into account. It deals with the real cause of stuttering that you are bound to take for granted. In public, you have to forget all about the problem with your speech defect. Just like a non-stuttering person who doesn't pay attention to his or her speech. The consciousness is out of 99% involved here. You only have to observe the 1% participation of the inborn cortical subconscious. You have to control the impulses in the bodily organs to hold them in coordination. In Neurologos Therapy, you have to watch the transition from open vocal folds to vocal folds, transforming the breathing out into the breathing out accompanied by voice.